Hello, I'm Suzanne Mira, one of the health educators with the Communicable Disease Service, and I would like to welcome you to today's training. Before we get started, I'd like to thank you for all of the continued work you're doing in response to the Zika virus situation and for being interested in educating the community about this disease. This is an updated Zika virus community education webinar, as there have been some changes since our first webinar back in February of 2016. During the initial webinar, we had approximately 370 people who joined, which shows just how much the public health community wants to educate New Jersey residents on this topic. This continues to be an evolving situation about a virus that is still being studied. We are expecting information about Zika to change and expand as the CDC and its partners learn more about the virus, how it spreads, and the effects it has. For that reason, the slide set you are about to see contains very general information. Social media affects the way people receive health information, and it is not always for the better. It is very easy for misinformation to be posted by people in comment sections on social media posts, and the public may have many questions. The slide set that you will learn about today was developed to help you provide accurate information about this virus and to help prevent serious birth defects in children born in New Jersey due to Zika virus infection in mothers. We hope that providing this slide set saves you some time and work, but more importantly, it allows us all to be speaking with one voice and to ensure that the public message is correct and consistent no matter which county or municipality is delivering the presentation. In addition to social media reviews, some content for this presentation has come from feedback from various Latino communities. The department has formed a Zika Community Outreach Work Group that continues to meet and discuss Zika communication activities so that we can keep the people of our state informed in a culturally competent manner. We have also developed several materials designed to provide information about Zika, including a Zika fact sheet, an infographic on preventing mosquito bites when traveling, a travel advisory for pregnant women, as well as the toolkit you will see shortly. We have translated as many of our Zika materials as possible. As the items are developed and approved, they are added to the NJDOH website, so please check our site frequently. As always, in the Communicable Disease Service, we approach our public education materials development in such a way that we incorporate risk communication and health literacy principles. This helps us to ensure that the information we provide is created in a way that helps people to better understand their risk, reduce anxiety, and ultimately ends in the people being able to take any necessary preventive behaviors. Risk communication is especially important with the Zika situation because there has been so much media coverage of the event and the potential exists for information to be misunderstood by the public. With regard to health literacy, we always strive to provide health information in language that is as simple as possible, avoiding unnecessary medical or public health jargon, and with description that helps the learner to hear, understand, and use the information appropriately. We spend a lot of time reviewing and revising the slides to achieve these two goals so that we are putting forth our best product possible. Now let's get to the program. Viewers who participated in the original webinar received a copy of the slides with the accompanying script, the program evaluation form, and a program report form. If you know of someone who plans to watch the webinar after the original broadcast and wants the slides and materials, they should send an email to Krista Reale, that's KRISTA.REALE @doh.nj.gov, and she will confirm that they have viewed the webinar and will send everything to the email address provided in GoToWebinar. First, I'm going to read through the slides, review the script, and address any important points to remember for the slide. The presentation starts off with what the Zika virus is. Zika virus is a viral infection usually caused by the bite of an infected mosquito. It can also spread by having sex with an infected partner. We are presenting this information because Zika can cause serious birth defects of the brain called microcephaly and other severe fetal brain defects and has been linked to problems in infants, including eye defects, hearing loss, and impaired growth in babies of mothers who were infected while pregnant. Scientists are studying the full range of other potential health problems that Zika virus infection during pregnancy may cause. Prior to 2015, Zika virus outbreaks have occurred in areas of Africa, Southeast Asia, and the Pacific Islands. Zika is not a new virus and was first discovered in mosquitoes in Zika Forest, Uganda in 1947. The virus was detected in humans in Nigeria in 1954. Until recently, outbreaks have mostly occurred in Africa and Asia. The first outbreak outside of Africa and Asia occurred on the island of Yap in the Federated States of Micronesia in 2007. As we know from risk communication studies, new and unfamiliar diseases cause greater concern. This slide is to help people know that the disease has been around for a long time. In May 2015, Brazil reported the first outbreak of Zika in the Americas. Zika is now present in many areas. Since this is an evolving situation, the list of affected countries is likely to change. For up-to-date lists of countries, please visit the CDC or the Pan American Health Organization websites. While the U.S. is home to the type of mosquito that transmits Zika, a widespread outbreak is not expected. If U.S. mosquitoes become infected with the virus, it will likely result in localized outbreaks, which can be controlled through good surveillance and mosquito control efforts. As of December 2016, locally transmitted cases of Zika by mosquitoes have been identified in only 2 U.S. states, Florida and Texas. And for those of you who will be instructors, please note that as of December 2016, the investigation of locally transmitted cases of Zika in Texas is continuing. This area was not designated by CDC as an area with ongoing Zika transmission. Additionally, in the U.S., there is widespread use of window screens and air conditioning, which reduce exposure to mosquitoes. The CDC's assumption is based on studies of other mosquito-borne diseases such as dengue and chikungunya that had localized transmission in the U.S. but did not expand to large uncontrollable outbreaks. With this slide, we're trying to provide some reassurance that large-scale ongoing outbreaks that are being seen in the tropics are not likely to occur here in the U.S. Although Zika is new to the Americas and spreading fast in the region, countries are responding proactively with support from the Pan American Health Organization and the World Health Organization. Now we're going to spend some time talking about what the disease is and how it behaves in the population. It is very important to understand that the Zika virus is still being studied and more is being learned each day. The information you hear today may change as the CDC learns more and makes new recommendations. Be sure to check the New Jersey Department of Health website and the CDC website often to see the most up-to-date information. The good news is that only about 1 in 5 people with Zika develop symptoms, and infection is usually mild. The most common symptoms are fever, rash, joint pain, or red eyes. Other common symptoms include muscle pain and headache. Symptoms usually begin 2 to 7 days after exposure, which is being bitten by an infected mosquito or sexual transmission, and last several days to a week. Hospitalization and deaths from Zika are rare. Zika is spread to people through the bite of an infected Aedes mosquito. This is the same mosquito that spreads dengue and chikungunya, which are similar mosquito-borne diseases. Zika virus can also be spread from person to person through unprotected sexual activity. This includes vaginal, anal, oral sex, and the sharing of sex toys. Zika can be passed through sex even if the person does not have symptoms. The script for this particular slide is quite a bit different than the original slide set from 2016 and is the result of the CDC learning more about how the virus spreads. Zika is not an airborne disease and cannot be spread by coughing, sneezing, or talking. This means that it is generally okay to be around people who may have been infected or who may have symptoms of the illness. You cannot catch Zika through the air. There has also been one confirmed case of Zika in a person with no known risk factors. However, this person did provide care to another person who had uniquely high amounts of Zika virus in his blood. It remains unclear how this person became infected with Zika. Family contacts should be aware that blood and body fluids of severely ill patients might be infectious, and healthcare personnel are reminded to use standard precautions when they might come in contact with high volumes of body fluids. People are often concerned about potential airborne disease transmission, and we saw this concern during the Ebola outbreak. People of certain ethnic backgrounds and those who traveled to areas of Ebola activity were stigmatized for being a health threat to others. What is an incubation period? An incubation period is the time from when a virus gets inside someone's body to the time the symptoms begin showing. Most people who are infected with Zika will begin to show symptoms within 2 to 7 days after being bitten by an infected mosquito. As mentioned earlier, Zika can result in some serious problems for a pregnant mother's unborn child, so the next few slides will focus on considerations for pregnancy. This section of the presentation is important because the CDC has studied a body of evidence regarding Zika and its effects on developing fetuses. We need to emphasize the importance of Zika prevention to ensure that pregnant women do not become infected. While the CDC is still studying the effects of Zika in pregnant women, there are some things that are already known. Zika can be spread from a pregnant woman to her unborn baby. Zika can cause a serious birth defect of the brain called microcephaly and other severe fetal brain defects, and has been linked to problems in infants, including eye defects, hearing loss, and impaired growth in babies of mothers who were infected while pregnant. Children born with microcephaly will face various developmental disabilities. The highest risk period for Zika-associated microcephaly is likely to be in the first half of pregnancy, particularly the first trimester and early in the second trimester. However, CDC recommends that women take steps to protect themselves during the entire pregnancy. The content of this script for this slide has become more detailed now that the CDC has learned more about the virus and the causative link between maternal infection and severe birth defects and impairments in their unborn babies. Microcephaly is a condition where a baby's head is much smaller than expected. Microcephaly can occur because a baby's brain has not developed properly during pregnancy or has stopped growing after birth, which results in a smaller head size. There is now scientific consensus that Zika virus is a cause of microcephaly. Until we better understand the association between Zika and poor pregnancy outcomes, the CDC advises several special precautions. Women who are pregnant in any trimester should postpone travel to any area where Zika virus transmission is ongoing. If you must travel to one of these areas, talk to your doctor first and strictly follow steps to prevent mosquito bites during your trip. Also, take steps to avoid sexual transmission of Zika. Couples who live in or travel to areas of active Zika virus transmission who have a pregnant partner should abstain from sexual activity or be sure to consistently and correctly use barrier methods against infection, such as male condoms or dental dams, during sex, including vaginal intercourse, anal intercourse, and oral sex, for the duration of the pregnancy. Women who are trying to become pregnant should consider avoiding non-essential travel to areas with active Zika transmission. And before you travel, talk to your doctor about your plans to become pregnant and the risk of Zika virus infection. There have been some changes to this script as compared to last year's for this slide to be consistent with CDC recommendations. Couples who live in or travel to an area of active Zika virus transmission who are concerned about sexual transmission of Zika virus to a non-pregnant partner might consider abstaining from sexual activity or using barrier methods against infection, such as male condoms or dental dams, consistently and correctly during sex. A woman thinking about pregnancy who may have been exposed to Zika should talk to her healthcare provider after returning. Women with a possible Zika virus exposure should wait at least 8 weeks after symptoms start or last possible exposure before trying to conceive. Men with a possible Zika virus exposure should wait at least 6 months after symptoms start or last possible exposure before trying to conceive. A possible Zika virus exposure is defined as 1. Recent travel to or residence in an area of active Zika virus transmission, Or 2, unprotected sex, vaginal intercourse, anal intercourse, and oral sex, and the sharing of sex toys with a partner who traveled to an area with Zika virus or has a positive Zika virus test result. Or 3, healthcare or laboratory transmission. Or 4, receipt of an organ or blood product from a person with Zika virus. This is a new slide for the 2017 version of the presentation and is based on current CDC recommendations for family planning relative to Zika virus exposure. Again, Zika can be passed through sex from a person who has Zika to his or her sex partners, even if the person does not have symptoms. This chart outlines the CDC recommendations to reduce the risk of sexual transmission of Zika by using condoms or practicing abstinence. Once again, this slide is new based on information the CDC has learned since last year's version of the slide set. The next topic we're going to talk about is prevention. No vaccine or preventive drug is available at this time, so prevention is important. The best way to prevent Zika is to avoid mosquito bites when traveling to an area where Zika is present. Use an EPA-registered insect repellent. Many insect repellents are safe for pregnant women and children to use, but be sure to check the product label for any warnings and follow the instructions closely. For information on how to best be protected against all diseases related to travel, visiting a clinician with expertise in travel medicine is recommended before a planned trip. As we said earlier, this situation is changing and the CDC is still learning more about this virus. It's important to know where you can find correct, updated information about Zika. Here are some organizations that will have updated, reliable information. Credible sources include national and international resources such as CDC, PAHO, and the World Health Organization, as well as state and public health agencies. Use caution when obtaining information from social media and even news websites. These sites are not always monitored and the information may not be correct. Myths and rumors spread quickly online, so always make sure to utilize credible and trustworthy sources. If you like to get information through social media, follow the New Jersey Department of Health on Twitter and like our Facebook page, facebook.com/NJDEPTOFHEALTH. The New Jersey Department of Health's Office of Communications has been great about getting new information out on social media and will continue to do so. Since Zika is not a disease that is familiar to us in the United States, it is only natural that people will have questions and concerns. Some of the questions people have been asking frequently include, who is at highest risk for getting infected with Zika? Anyone who is living in or traveling to an area where Zika virus is found who has not already been infected with Zika virus is at risk for infection. What should I know about Aedes mosquitoes? Aedes mosquitoes transmit Zika, chikungunya, and dengue. They are outdoor and indoor daytime biters and are strongly attracted to bite humans. These mosquitoes use both natural habitats and artificial containers to breed. The map on the left shows the distribution of two different Aedes mosquitoes in the United States, Aedes aegypti on the left and Aedes albopictus on the right. Currently, only Aedes aegypti is known to spread Zika. New Jersey does not have the species of mosquito. However, it is possible that other species of mosquitoes have the ability to spread Zika, including Aedes albopictus, which we have in New Jersey. What is the difference between Zika, chikungunya, and dengue? All of these diseases present similar symptoms, but certain symptoms suggest one disease or another and help doctors make a diagnosis. Dengue usually presents with higher fever and more severe muscle pain. There can be breaks. Attention should be paid to warning signs such as bleeding. Chikungunya presents with higher fever and more intense joint pain, affecting the hands, feet, knees, and back. It can disable people, bending them over so that they cannot walk or perform simple actions such as opening a water bottle. Zika does not have clearly characteristic features, but most patients have skin rashes and some have conjunctivitis or red eyes. How is Zika treated? There is no specific treatment for Zika. Symptoms are treated by getting rest, drinking fluids to prevent dehydration, and taking medicines such as acetaminophen or paracetamol to relieve fever and pain. Aspirin and other non-steroidal anti-inflammatory drugs like ibuprofen and naproxen should be avoided until dengue can be ruled out to reduce the risk of increased bleeding. Can I travel to countries affected by the outbreak? Since Zika is spread by mosquitoes, CDC recommends that travelers to areas with ongoing transmission protect themselves from mosquito bites. Women who are pregnant in any trimester should consider postponing travel to any area where Zika transmission is ongoing. If you are pregnant and must travel to one of these areas, talk to your doctor first and strictly follow steps to prevent mosquito bites during your trip. Women who are trying to become pregnant should talk to their doctor about plans to become pregnant and the risk of Zika virus infection before travel and strictly follow steps to prevent mosquito bites during travel. Couples who are trying to become pregnant or planning to conceive in the near future should consider avoiding non-essential travel to areas with active Zika transmission. What are EPA-registered insect repellents? Insect repellents registered by the Environmental Protection Agency, or the EPA, indicate that the materials and active ingredients have been reviewed and approved for human safety and effectiveness when applied according to instructions on the label. Insect repellents registered by the EPA will say EPA registered on the product label. Please remember that all insect repellents should be used according to instructions on the label. Many insect repellents are safe for pregnant women and children to use, but be sure to check the product label for any warnings and follow the instructions closely. Are natural prevention methods and remedies effective? Home remedies to keep mosquitoes away and/or relieve mosquito bites may or may not be effective. It is important to use products that have been reviewed for safety and effectiveness. Again, insect repellents registered by the Environmental Protection Agency are safe and effective when applied according to instructions on the label. Using an EPA-registered insect repellent is one of the best ways to prevent any mosquito-borne disease. There is no scientific evidence that eating garlic, vitamins, onions, or any food will make a person repellent to mosquitoes. Similarly, just because a product or method is natural does not mean it is safe or will work. This is a new slide that was added based on the results of focus groups conducted in New Jersey among Hispanic women. Each group that participated identified home remedies or natural alternatives to CDC's prevention recommendations. Is it safe to get pregnant after traveling to a country with Zika? If infected, Zika virus usually remains in the blood of an infected person for about a week. There is no evidence the virus will cause infections in a baby that is conceived after the virus is cleared from the body. Once a person has been infected, he or she is likely to be protected from future infections. Zika virus can remain in semen longer than blood, and couples planning a pregnancy should follow the CDC guidelines. More details were added to this slide and script based on new information learned by the CDC. Can Zika be spread through breastfeeding? To date, there are no reports of infants getting Zika through breastfeeding. Because of the benefits of breastfeeding, mothers are encouraged to breastfeed even in areas where Zika virus is found. Mothers who are breastfeeding in areas where Zika virus is found should practice mosquito prevention measures such as using insect repellent. Again, a widespread Zika outbreak in the U.S. is not expected. Zika is not an airborne disease and cannot be spread by coughing, sneezing, or talking. The best way to prevent Zika is to avoid being bitten by a mosquito carrying the disease. Everyone traveling to an area with ongoing transmission of Zika should protect themselves from mosquito bites. We cannot emphasize enough that women who are pregnant in any trimester should postpone travel to any area where Zika transmission is ongoing. Couples planning to become pregnant should consider avoiding non-essential travel to areas with active Zika transmission. Women who must travel should talk to their healthcare provider. Additional information was added to the script for this slide, bringing it in line with current CDC recommendations. What is CDC doing about Zika? CDC has been aware of Zika for some time and has been preparing for its possible introduction into the United States. Laboratories in many countries have been trained to test for chikungunya and dengue. These skills have prepared these laboratories for Zika testing. CDC is working with international public health partners and with state health departments to alert healthcare providers and the public about Zika, to provide state health laboratories with diagnostic tests, and to detect and report cases which will help prevent further spread. What is New Jersey doing about Zika? The New Jersey Department of Health is communicating with local health departments and healthcare providers through health alert messages and conference calls to increase their awareness. Updated information will be posted to the NJDOH website as updates become available. For those of you who will be instructors for this program, you may want to include some information that is relevant to your local efforts that people can relate to. Where to learn more. Encourage people to look at these websites or call the CDC hotline to learn more. If there is a public call center open to respond to public inquiries, please provide the information here. As of April 2016, a 24/7 call center has been opened and staffed by the New Jersey Poison Information and Education System, also known as NJPIES. This slide was enhanced by adding information on the availability of the Zika call center where people can have their questions answered. And that wraps up the presentation. The last slide is for you to conduct questions and answers with your audience. Now going back to the toolkit, everyone who gets this program will have a program evaluation form. The program evaluation form should be provided at the end of the presentation. It gathers general information about the quality of the program, captures some information about participant beliefs about the risk of Zika and knowledge gain, and provides an opportunity for the participants to identify the most and least useful parts of the presentation and what the key takeaway messages were for them. The program report form is for the facilitator of the meeting to complete and will provide us with process measures such as the date and location of the presentations, what type of audience it was, and how many people attended. When you are done presenting, collect the evaluations and send them to me along with your program report form, all clipped together. We will be looking at all of these forms to assess how well the program is going. That completes the review of the program materials. Thank you once again for your interest in this program. I am looking forward to hearing about how your programs are going and will be taking a look at the program evaluations. I wish you all the best as you head out into your communities and begin giving this presentation. Thank you.